listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, we've got the details on Medicare Extra Help, or the Low Income Subsidy, depending on what you call it. Learn how you can look up this information for clients, eligibility requirements, and more. How to check Medicare Extra Help eligibility for your client, written by Roxanne Anderson. Agents can play a significant role in getting clients financial assistance for prescription drug coverage and medications. But how do you know if your client is eligible for the Medicare Extra Help program? What are the income limits for Part D Extra Help? Are there Medicare Extra Help lookup tools? We are answering these questions and more. If you'll be discussing prescription drug coverage during an appointment, it's important that you verify whether your client qualifies for the extra help with Medicare. This federal program could mean the difference between your client having affordable access to important medications in their doctor's treatment plan or not. And remember, just because a client does not meet the Medicare Extra Help income limits, that does not automatically disqualify them from state assistance programs. The eligibility guidelines for these programs can differ, so be sure to check on a client's eligibility for both types of assistance. Let's get into the details of the Medicare Extra Help program. You might have also heard it referred to as the Medicare Low Income Subsidy Program, usually abbreviated in materials as LIS. The program is a joint effort by the Centers for Medicare and Medicaid Services and the Social Security Administration to provide financial assistance to those who need it to pay for their Medicare prescription drug coverage and prescription drugs. Here's how the LIS Extra Help program works. Enrollees in this program usually do not have to pay premiums for their prescription drug coverage, deductibles for their prescription drug coverage, unless they only receive a partial subsidy instead of the full one. They do not have to pay the Part D late enrollment penalty, full copays or coinsurance, more than $4.50 for each generic drug, and more than $11.20 for the prescription drugs their plan covers. And then once total drug costs reach $8,000, your client pays $0 for each covered drug. If your client also gets full Medicaid coverage, and they're in the Qualified Medicare Beneficiary, or QMBE program, they won't pay more than $4.60 for each covered drug. Program members also get a monthly special enrollment period to join or switch Medicare Part D plans. Over the course of a year, someone on Medicare who is receiving extra help could potentially save about $5,900. Now that we know how the program works, let's talk about who qualifies for Medicare Part D Extra Help. Some people automatically receive the LIS, meaning they don't need to complete the Extra Help application. For example, individuals who are eligible for both Medicare and Medicaid, so dual eligibles. People who receive Supplemental Security Income, or SSI, and those who qualify for a Medicare Savings program. As far as qualification goes, agents should be prepared to look up or verify Medicare Extra Help status. Why is that? Well, it's unlikely your clients will know or recognize if they qualify for or receive the extra help unless they've applied for it. And even then, their status may have since changed. During appointments, agents should confirm whether their client qualifies for the low-income subsidy before enrolling them in a prescription drug plan. By doing this, you'll be acting in your client's best interests, helping them to afford the medications they need and even save money on their prescriptions. What better way to show your clients that you're the right agent to get the job done? To qualify for the LIS or Extra Help, an individual must have Medicare Part A and or Part B and live in one of the 50 United States or the District of Columbia. They must have less than $34,360 total in savings, investments, and real estate net worth if they are married. If they are single, that net worth threshold drops to $17,220. Other exceptions may apply, and these dollar limits may change from year to year. Another monetary requirement for eligibility: annual income is limited to $30,660 for those who are married and $22,590 for those who are single. Now that we know the requirements, let's go over some lookup tools and methods because there are more than one. There's actually 5 ways to complete this task. This process will likely be easier for you to look up a client's LIS status for them or with them, rather than trying to explain to your clients how to do it themselves and then waiting for an answer. If you're ready to verify a client's LIS status, you can do this with CMS or the carrier, online or over the phone. Number 1, use an LIS lookup tool in a carrier's portal if the carrier has one. Number 2, call the carrier and ask to confirm your client's LIS eligibility. Number 3, call 1-800-MEDICARE. That's 1-800-633-4227 and ask to confirm your client's LIS eligibility. Number 4, have your client create and or log in to their mymedicare.gov account and check if they qualify for the LIS. And number 5, ask your client to use the Find Out If You Qualify tool available on ssa.gov. These tools are available pre-enrollment to check a client's eligibility prior to enrollment. Very important to remember that you want to verify eligibility prior to any enrollment steps. Earlier, we mentioned changes in eligibility status. So you might be wondering, will my client be notified if their extra help status changes? The answer to that is yes. If your client's extra help status changes, they should receive a notification from CMS or the Social Security Administration via mail. The color of the notice will vary depending on the purpose the notice serves. For example, an individual who has both Medicare and Medicaid and is in a Medicare savings program or gets supplemental security income will automatically qualify for extra help. Their letter will come from CMS, and the notice will be purple. Those who qualify for Medicare and Medicaid and currently get benefits through Original Medicare will automatically qualify for extra help because they'll be auto-enrolled in a prescription drug plan. Their notice will also come from CMS, but it will be either green or yellow. For a beneficiary already enrolled in the Extra Help program, but has a pending copayment change, they will receive an orange notice from CMS to let them know about the change. With the 3 notices we just mentioned, the purple, green or yellow, and orange, the beneficiary qualified automatically for the low-income subsidy, so there's no need for them to apply or reapply. But that's not always the case. For a client who used to get extra help automatically, but no longer automatically qualifies, they'll receive a gray notice letter from CMS. They will need to reapply. And then sometimes clients sign up for their plan without realizing they are eligible, or their eligibility changes. In this case, the Social Security Administration will reach out and let your client know through the Social Security Low-Income Subsidy and Medicare Savings Program outreach notice. Also, because this letter comes from Social Security and not CMS, There is no color code on this type of notice. If you'd like a visual Medicare Extra Help status cheat sheet, I recommend visiting the blog post that goes along with this episode. We will have the link to the text version in our episode notes, and you'll see the table when you scroll down the page. Our last two examples of notices mentioned either applying or reapplying for the low-income subsidy. Couple more details on that process. Anyone who does not automatically get the low-income subsidy should complete the Medicare Extra Help application if there's a chance they are eligible for it. If you think your client may qualify for this program, you can help them apply for it via the Social Security Administration's website. Clients can also call or visit their local Social Security office to apply. Individuals who need further assistance can contact their State Health Insurance Assistance Program, or SHIP. Couple of different ways to check for eligibility, couple of different ways to apply. But the most important takeaway here, make sure you're checking for eligibility ahead of enrollment. According to CMS estimates, 3 million Medicare beneficiaries are not enrolled in the government's Medicare Extra Help program, but could benefit from it. Don't let your clients be a part of this statistic. Help them take advantage of the financial assistance they're entitled to, but may not know about, starting today. And don't forget to visit the notes for all of the links we mentioned in this episode. While you're tapping around in those links, we would love it if you tapped that follow button to make your love of our podcast official. It is a great way to tell us you like what we're doing, and it helps us to keep doing it. Thank you so much for that, and thanks for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Roxanne Anderson. Script adaptation by Tina Lamoureux. Recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Follow along with our show wherever you like to listen.